Welcome back, everyone. A new report shows the burden Alzheimer's has on families is actually growing. And then another report shows the seniors are not receiving cognitive assessments on a routine basis. We're glad to have Kristen Dickens and Dr. Morgan Sauer here to talk more about this disease. Hey, thanks so much for joining us in studio.
Thank you for having us.
So first, let's talk about more of the findings that we're seeing in this report.
Absolutely. So we know that there are over 5 million individuals in the nation living with Alzheimer's disease. Here in Arkansas, that means that there are over 60,000.
Wow.
In terms of caregivers, what that means is that there are over 178,000 caregivers just in the state of Arkansas. And largely we know that those caregivers are unpaid.
And that's a lot. Also, the numbers, the death rates are climbing that I've seen in this. And also the costs for families and across the country, they're going as well. Why is this increasing all across the board?
One of the biggest factors of Alzheimer's disease is age. The more we age, the higher our risk of getting this illness. And we're actually living longer than we've ever lived before. We are combating a lot of the chronic illnesses that we're aware of. Heart disease, breast cancer, prostate cancer, and we're doing well on those fronts. We're reducing smoking to reduce lung cancer, but Alzheimer's, we don't have a cure for. In fact, we're not even sure what truly causes it.
Right.
And so as time moves forward, more people wind up getting Alzheimer's. We know these numbers are falsely low reported because there's a lot of stigmas against Alzheimer's disease. So these numbers are actually higher. We just don't know how to calculate it.
Yeah, I want to read a statistics in a study. It says when it says only 16%, and that's 1 in 7 seniors, are receiving assessments for memory and thinking issues. So what does that tell you?
So it definitely tells us that we need to pay closer attention to cognitive assessments. So that is something that is regularly included in your annual wellness visit if you are receiving Medicare. But we know that either patients are reluctant to bring this up with their physicians, or physicians are saying that even though they find it's important, it's not standard practice in their assessment.
Yeah, and you bring it up too, you know, because the study also shows that seniors who are experiencing those memory loss or just having thinking issues, they're not bringing it up to their physicians. So why is that?
As Franklin Delano Roosevelt said, the greatest thing we have to fear is fear itself. And there's a lot of fear with Alzheimer's. There's a lot of stigma about having the illness because it does cause a loss of a personality. I can tell you this because my mother's 9 years into the illness, and it's a very sad thing to watch. We do not have a cure, and a lot of people are very afraid about talking about these types of things. Doctors don't want to make their patients angry by giving them something that they don't want, and patients and families don't want to hear it because denial, even though it's not a good coping mechanism, we use it way too often. It's important to talk about it out loud and not be afraid. There are things that we can do to help, and planning for the future to prevent disasters is the best way to go.
For people who want to help out or for more information, where can they go?
Yeah, so our website is alz.org. We also have a helpline, which is 24/7 available to you, where we have master's level clinicians that can answer on the other end. And I think that number will pop up on the screen at some point. But we have many programs here locally in Arkansas. We serve every county in the state where we can offer you, whether they're education programs about how to communicate with my loved one that is dealing with it, or know the 10 signs if you don't yet have the diagnosis, but you want to be proactive.
All right, Morgan, Kirsten, thanks so much for joining us today.
Thank you for having us.
All right, we'll be right back.